Okay, let's just dive right in. Today, we're unpacking an explainer that is honestly absolutely critical, but so incredibly misunderstood. We are breaking down the 12 silent signs of breast cancer, and we're actually grounding this whole explainer in the brilliant insights of Dr. Liz O'Warden. She's not just a highly experienced breast surgeon, but she's a 3-time breast cancer survivor herself. So she literally knows this from both sides of the examination table, and I promise you, her insights are going to completely change how you think about breast health.
Right, we have to start with this quote because it completely shatters the biggest misconception out there. When we think of cancer, we kind of expect these huge warning signs, right? We think we're going to feel terribly ill, completely exhausted, or be in severe pain. But as Dr. O'Riordan emphasizes from her own 3 battles with the disease, early breast cancer simply doesn't work like that. You can have it and honestly feel 100% completely fine.
So here's our roadmap for today. We're going to group her 12 signs into a logical order so they're super easy for you to remember. We'll start with the silent reality, move through visual skin and nipple changes, then shift to tactile lumps and pain, and finally look at signs of early spread.
All right, part 1, the silent reality, myth versus reality.
Here is the crucial takeaway. Your body is not going to send off a blaring internal alarm. Because you might feel perfectly healthy, your only true defense is your own physical awareness, what you can actually see in the mirror and what you can feel with your hands. Those are literally your best tools for catching this early on. Moving right along to part 2, skin and shape changes. These are your visual warning signs. Okay, so there are 4 main visual changes to look out for. First up is a skin color change. Now, on light skin, this might look pink or red, but it's super important to note that on darker skin tones, it might look like a darker brown or even a purple bruise. Second is localized skin swelling. Third is skin dimpling or tethering, basically where the skin pulls inward. And fourth is a sudden, unexplained change in the overall size or shape of just one breast. Look, our breasts are sisters, they aren't twins, right? Natural variations are totally normal. What we're looking for here is a sudden, new change in one breast that just doesn't go away. Now see this chart? It puts those first 2 signs, the color changes and the swelling, into context. They are often tied to something called inflammatory breast cancer, or IBC. And as you can see, IBC is actually really rare, making up just 1 to 5% of all breast cancer cases. But here's why you absolutely need to know about it. Despite being such a tiny percentage of cases, it causes 10 to 15% of all breast cancer deaths. Why is that? Well, because IBC comes on incredibly fast. We're talking sometimes literally appearing overnight, and it's dangerously often dismissed as just a standard skin infection or mastitis. If a doctor gives you antibiotics for a supposed breast infection and the redness or swelling hasn't cleared up in a week, you absolutely must go back and ask for a biopsy. Which brings us to a really specific visual sign known medically as peau d'orange. It literally translates from French as orange peel. What happens is cancer cells block the tiny lymph vessels in your skin. Fluid builds up, your pores get enlarged, and the breast takes on this dimpled texture exactly like an orange peel or cellulite. It usually just affects one breast, making it feel noticeably heavier and swollen. Now, sign number 3, dimpling or tethering, is incredibly stealthy. Honestly, you probably won't see it if you're just standing normally in front of the mirror. You actually have to do a little bathroom aerobics. Put your hands firmly on your hips and push in, or raise your arms way up high above your head. This stretches the skin. If there's a tumor growing inside, it can pull on this fine connective tissue called Cooper's ligaments. When you stretch your arms, that pulling causes a visible pucker or dimple right in the skin. All right, part 3, nipple warning signs. Let's see how changes specific to the nipples can be crucial early indicators. We can group these next 3 signs together. Sign 5 is a new nipple inversion, meaning a previously outward-pointing nipple suddenly turns inward and gets stuck. Sign 6 is a new persistent nipple rash, and sign 7 is a specific type of nipple discharge. The absolute key word for all of these is new. Lots of people naturally have inverted nipples from puberty, and that is completely normal. We're only looking for a sudden change in direction that feels fixed and can't be pulled back out. Let's zoom in on sign 6, the nipple rash. This is often tied to a rare cancer called Paget's disease. And this one is super tricky because it perfectly mimics eczema or contact dermatitis. It's scaly, red, crusting, and intensely itchy. It is so deceptive that patients often spend months putting steroid creams on it with absolutely zero success. So if you have what looks like eczema on your nipple and it does not clear up with standard treatment, you need to push for a biopsy. And then there's sign 7, discharge. The critical thing here is knowing the difference between normal fluid and warning fluid. If the discharge is cream, yellow, or green, and it only happens when you squeeze, honestly, stop squeezing. That's generally totally normal and harmless. But if the discharge is spontaneous, meaning you're just finding it in your bra out of nowhere, and it's clear like water or blood-stained, and it's coming from only one side, that requires immediate medical checking. No waiting around. Moving into section 4, lumps, thickening, and pain. This is all about transitioning from what you see to what you actually feel. So here are 5 tactile signs to be aware of. Sign 8 is a vague thickening or firmness. Sign 9 is a lump in the armpit or on the collarbone. 10 is breast pain. 11 is recurrent breast cysts that just won't quit. And 12 is your classic breast lump. Now, a classic lump is definitely the most common sign, often feeling like it literally appeared completely overnight. But as you can see from this list, it is far from the only texture change you need to be feeling for. That thickening one, sign 8, it's fascinating, but honestly, terrifyingly subtle. It's often caused by something called invasive lobular cancer. Unlike most cancers that grow into this hard little ball, this type starts in the milk glands and spreads in these single file lines. It's almost like fingers reaching through the tissue. Because of that, it doesn't form a distinct lump. Instead, you'll just feel like a vague area of the breast has suddenly become firmer, denser, or thicker than everything around it. Let's talk about sign 10 and bust a massive myth about breast pain while we're at it. A huge study actually showed that women presenting with isolated breast pain as their only symptom have a tiny, like 0.4% risk of cancer. Harmless cyclical pain that builds up before your period, totally normal. But if you have persistent, non-cyclical pain that stays in one exact spot, gets progressively worse, or especially if it comes with any of those visual signs we just covered, that absolutely needs to get checked.
Oh, and a quick reminder on sign 9, do not just check your breasts. Check your armpits and your collarbones too. Breast cancer can sometimes spread to the lymph nodes in these areas before a lump is even big enough to feel in the breast itself. So if you find a firm, non-squishy lump in your armpit and you haven't just had a bad cold or an infection, go get it assessed.
Finally, section 5, signs of early spread. We really need to address what happens when the cancer is already advanced by the time it's found. In roughly 6 to 7% of cases, patients present with what is called de novo metastatic breast cancer. That basically means the cancer is already advanced right from the get-go. In these situations, the cancer essentially skips all those localized warning signs in the breast, and instead it presents entirely through symptoms of spread elsewhere in the body. Let's look at this table to see what that actually looks like. If the cancer spreads to the bones, it might show up as a deep, persistent ache in the hip or back that gets way worse at night. In the lungs, we're talking about an unexplained dry cough or just sudden shortness of breath. Liver spread might present as unexpected weight loss or yellowing of the skin. And if it spreads to the brain, it could cause totally new, severe headaches or even double vision.
Okay, I know looking at that massive list of physical and systemic symptoms can be incredibly overwhelming, but I really want to reassure you here. Please remember that most of the time, women who go to a clinic with these symptoms do not have cancer. The vast majority of the time, these changes are completely harmless. But the absolute only way to know for sure, and to give yourself that peace of mind, is to have a medical professional check it out.
We have literally covered so much ground today, right? We took some pretty complex medical realities and turned them into a guide you can actually use. So here's my challenge for you. Are you going to take just 5 minutes today to do a thorough check? And who in your life are you going to share this explainer with? Knowing these 12 silent signs genuinely has the power to save a life today. But it makes you wonder, right? With the science of early detection constantly evolving, what new invisible warning signs or incredible diagnostic tools will medical science uncover tomorrow? Keep learning, keep checking, and I'll see you in the next one.